Welcome to the Lynn Cancer Institute Zoom and Connect updates, what we all need to know in 2022. We're very grateful to have all of you with us today and to learn from our esteemed speaker, Patricia Jacobs. Dr. Jacobs will be educating us on medical cannabis, a conversation that I know we're all curious about. At the Lynn Cancer Institute, we believe that education, prevention, screening and early detection, treatment options, the expertise of our staff, and our latest technology will truly save lives. During this presentation, your Zoom will be muted. So in the interest of time, Lee has sent the physician bio to you. We invite you to please take notes. And when you have a question, please write it in the Q&A or in the chat box, as Dr. Jacobs will not be able to see you or hear you during her presentation. And at the conclusion, she'll have plenty of time to respond to your questions. We're very proud to welcome you to our Lynn Cancer Institute and to introduce and welcome Dr. Patricia Jacobs. Dr. Jacobs.
Thank you, Janet. Thank you for joining for this Zoom and Connect. I hope you'll find the information I share about medical cannabis interesting and helpful. My medical practice at the Lynn Cancer Center Classic program is dedicated to supporting people who are coping with cancer and cancer treatment. And I find the medical...
Dr. Jacobs, I just want to interrupt. Somebody has sent in and said that they cannot hear. Can everyone
I can
hear?
hold up the microphone. Is that better?
Let's see, is that better? Okay, they can hear you now.
All right.
Thank you.
So my focus will be on the role cannabis, also known as marijuana, can play in the care of individuals with cancer, primarily for management of distressing symptoms, but I'll also cover some basics about how it works in the body and how someone with a qualifying diagnosis like cancer can be certified to purchase medical cannabis in Florida. This is a graphic I use to show the most common symptoms that people with cancer struggle with. Medical cannabis can help pain, nausea and vomiting, loss of appetite, anxiety and depression, insomnia, and sometimes fatigue. It generally doesn't help with constipation, but with the potential to help with all these other symptoms, you can see why there's interest in the medicinal properties of cannabis for symptom relief. In fact, when patients were surveyed about why they used medical cannabis, pain, insomnia, anxiety, nausea, and poor appetite were the reasons they cited most often. In my experience, patients find it most helpful for improving appetite and helping them sleep. So what is cannabis? Cannabis, or marijuana, is an ancient plant first grown in Central Asia that's been used in some form, including for medicinal purposes, for thousands of years. The marijuana plant makes a resin that contains chemicals called cannabinoids that cause drug-like effects in the body. There are 3 subspecies of the cannabis plant: sativa, indica, and ruderalis. If you're familiar with cannabis, you've likely heard of sativa as the more activating plant and indica as the more relaxing, sedating one. Experts actually state that there's been so much inbreeding of the plant to produce varieties that target certain desired effects that the classification of sativa versus indica has lost much of its meaning. The chemicals or cannabinoids that are present in cannabis are better referred to as phytocannabinoids, meaning that they're cannabinoids from a plant source. The ones that are most important are delta-9 tetrahydrocannabinol, THC, and cannabidiol, CBD. You may be familiar with the fact that THC is the component of cannabis that causes the psychoactive effect or high. This effect is desirable to some individuals and undesirable to others. CBD doesn't have a psychoactive effect. In addition to these two major cannabinoids, there are minor cannabinoids like CBA, CBN, THCA that contribute meaningfully and deserve attention, as well as non-cannabinoid chemical components such as terpenes and flavonoids. Terpenes, for instance, give cannabis their odor, flavor, and color. It's also interesting that there is an entourage effect. That means that the effects of the cannabinoids in cannabis is enhanced by the non-cannabinoid components like the terpenes and flavonoids. Why is this important for you to know? Well, because there are a large number of different cannabis products available for purchase that are designed to produce specific effects based on the combination of all of these chemical components. It's not uncommon for someone to say that they tried medical cannabis and did or didn't like it. But as you can see, there's so many combinations that can be present in a single product that it's important for each person to try products that target their unique needs before deciding if medical cannabis is or isn't worthwhile addition to their treatment plan. Briefly, I'll tell you how the phytocannabinoids in medical cannabis work in the body. Humans have their own system called the endocannabinoid system that helps maintain balance in the body. And this system includes receptors on cells throughout the body, including in the brain and nervous system, as well as cells of the immune system. The receptors interact with chemicals the body normally produces, endocannabinoids. These are similar chemicals, but made in our own bodies, as opposed to phytocannabinoids made by the cannabis plant. So when people use medical cannabis, the phytocannabinoids in the cannabis interact with the body's own cannabinoid receptors, leading to a reduction in excess nervous system activity and inflammation that in turn leads to improved balance or homeostasis in the body. Some people theorize that cannabis is most effective in people who have a deficiency of their own endocannabinoids, and this is why using cannabis is so helpful for them. No, there's not currently a blood test that's available to test your level of endocannabinoids. Overall, this is a simplification of a complex system, but hopefully it gives you an idea of how cannabis affects the body. Since THC and CBD are the major cannabinoids found in cannabis, it's helpful to look at a list of effects of each component. The THC, as I said, is the psychoactive component, and even at doses where it doesn't cause a high, it can be sedating and relaxing, making it helpful for some people who have trouble sleeping. It also can increase appetite and reduce nausea and vomiting, especially nausea and vomiting related to chemotherapy. Some people find the high from THC to be unpleasant. CBD doesn't have a psychoactive effect and doesn't make people feel high. In fact, medical cannabis products with a balance of CBD and THC will be less psychoactive, allowing people who don't want the psychoactive effect to benefit from the therapeutic properties of the THC. Products with the balance of CBD and THC also can be more effective for pain relief and for reducing anxiety and depression as well. So how do you approach selecting medical cannabis products to try? All these factors are important. Obviously, the dosage consumed is important. To use cannabis successfully for symptom relief, it's critically important to start low and go slow. You should use the lowest dose that achieves the desired effect. Packaging for medical cannabis products will have clearly listed the number of milligrams of THC and CBD the product contains. Products can come in various forms, such as oils and tinctures that can go under the tongue and are measured out with a dropper. This is a good way to start low and slowly increase the number of drops over time to see what dose is effective. Some people don't find the taste appealing, however, And many of my patients would have difficulty with using the dropper because it can be hard to control the number of drops that come out, which defeats the purpose of trying to start low and go slow. Capsules of medical cannabis are also available, but they come in fixed doses. So these are best used by people who've learned the dose that works well for their desired effect. Another way to ingest medical cannabis is with gummies and with edibles, the most popular being gummies. A typical gummy will have 10 milligrams of THC and a variable amount of CBD. Again, it's usually best to start with a small amount, perhaps a quarter of a gummy, and work up from there as needed. As I mentioned before, the amount of THC and CBD listed as a ratio will determine the effect of the product, as well as the profile of other minor cannabinoids, terpenes, and other components. The route of administration is also important, as whether you take a product under the tongue, sublingually, orally, or by inhalation will affect how quickly it works and how long it will last. The age, health, and other medications taken and history with cannabis will also influence the effect of the cannabis on the individual. Patients who've never tried cannabis may feel nothing the first time they use it. I always tell my patients to wait the proper length of time for it to kick in. And if they truly feel no effect or side effects, to try the same dose again before increasing for that reason. This slide shows you more details about how the different formulations of medical cannabis take different amounts of time to start working and to wear off. You can see that oils and tinctures given sublingually using a dropper kick in pretty quickly, usually within 30 minutes, and the effect should last 4 to 6 hours. This is pretty reasonable, but the downsides are, again, the taste, and also some people have difficulty being accurate with the dropper, as I mentioned, and this can make the dosing unreliable. The product can usually be mixed with food like applesauce, but it's important to put it in a small volume, like a tablespoon worth, so that the individual is able to eat it completely. Otherwise, you don't know how much you've actually consumed. Capsules start working in 1 to 2 hours and last 6 to 8 hours, but you need to know the dose is right for you before choosing this route, since it can't be divided. Edibles became available in Florida 2 years ago. Gummies are easy, portable, and generally taste good, and are the most popular edible product. Like the capsules that need to be absorbed from the stomach, they take 1 to 2 hours to kick in and last 6 to 8 hours. I'll talk a bit later about safety, but I do want to highlight here that edibles have the potential to be the most risky formulation of cannabis if people don't wait the full 90 to even 120 minutes to gauge the effect of the product they've consumed and proceed with taking more. When this happens, once the doses kick in, the person can have a cumulative effect, including the side effects. This is called stacking, where multiple doses stack and add on to each other. This can be really uncomfortable for the person and is not an uncommon presentation at the hospital emergency room. So to prevent this, wait for the full 1.5 to 2 hours after taking an edible to assess for effect and side effects. Vaping and smoking are favored by many because the effect of the cannabis comes on very quickly, within 5 minutes and often pretty immediately, although it'll wear off quickly within 2 to 4 hours. For people who find cannabis helpful for sleep, nausea, or pain, having such fast onset is obviously an advantage. I generally avoid recommending inhaled cannabis, though, to my patients, unless they have no underlying lung conditions or spread of their cancer to the lungs. Topical preparations are less popular, but can be helpful for some conditions. So I've talked about the cannabis plant, its chemical components, and a bit about the different formulations it comes in. What do we know about how well it works? It's important to give some background first before talking about the research on cannabis. A lot of research on medications, chemotherapies, and other therapeutics that are offered to patients is funded by the government. Federal funding for research on cannabis is extremely limited because the federal government has classified cannabis as a Schedule I controlled substance, meaning that, in their view, it is no currently accepted medical use and carries high potential for abuse. By federal law, possessing cannabis is illegal in the US unless it's used in approved research settings. In order to carry out a study on cannabis, researchers must go through multiple difficult additional steps, including filing an investigational new drug application with the FDA, having a Schedule I license with the U.S. Drug Enforcement Administration, and having approval from the National Institute on Drug Abuse. In addition to all this, the cannabis that can be used in clinical trials must be obtained from a single supplier that is government approved. So understanding that research into cannabis is limited, here are a few pieces of information that should be of interest. A review of the available research in 2015 confirmed that medical cannabis is effective in reducing pain, nausea, and vomiting. A study in 2018 showed that 36% of patients no longer needed opioids for cancer-related pain when they used cannabis. An additional 10% were able to reduce their opioid dose. Those are medications like morphine, oxycodone, Vicodin, things like that. THC has been shown to be effective for chemotherapy-related nausea and vomiting, which actually led the FDA to approve a synthetic form of THC called dronabinol, or brand name Marinol, to be FDA approved for chemotherapy-related nausea and vomiting. It can be prescribed like other controlled substances and can be purchased at the pharmacy, and in some cases is covered by insurance. It's most likely to be covered by insurance if it's prescribed for the FDA-approved indication, which again is chemotherapy-related nausea and vomiting. It's also FDA-approved for HIV-related weight loss. So dronabinol or Marinol is often prescribed for cancer patients with poor appetite and weight loss, but it may not be covered by insurance if not in the setting of HIV disease. I sometimes will prescribe a small number of Marinol pills to people who are willing to and able to pay cash so they can see if it helps them and if it's worth paying out of pocket for. I also usually suggest checking the GoodRx app for the best price at a pharmacy in the area. This is really an aside, as dronabinol is not medical cannabis. It contains THC only, not any CBD or any of the other minor cannabinoids, terpenes, or other components that together and through the entourage effect bring on symptom relief. But dronabinol is out there as an option for people with cancer who have nausea and loss of appetite, who might want to try THC before considering trying medical cannabis, especially since medical cannabis isn't covered by insurance. So far, I've focused on medical cannabis as a tool for symptom relief in individuals with cancer. What about cannabis as a treatment for cancer? As you can guess, based on what I've told you, research on humans is very limited. There's a lot that has been learned about cannabis that makes people hopeful that cannabis can play a role in cancer treatment, but this is based on in vitro, which means in tumor cells in the laboratory, not in living animals like mice or humans, or in some cases in animals like mice. There have been no prospective clinical trials of medical cannabis for cancer treatment in people. Rick Simpson oil is a product that some patients use to try to treat their cancer with high doses of cannabis. Efforts have been made to change the government classification of cannabis from Schedule I to a lower schedule, which would impact availability of cannabis and also the flow of federal funding into research. But that's not where we are today. So I've given you an overview of what cannabis can do to benefit patients with cancer and what we wish it could do, but do not have clear scientific evidence in humans that it does do. What about side effects? I've talked about the psychoactive high that THC at certain doses causes, and how that can be reduced by using a product that has a balanced ratio of CBD to the THC, as the CBD can reduce the psychoactive effect. The THC is also responsible for the potential for distorted perception, loss of motor coordination, and impaired driving. I generally don't offer medical cannabis to people who are unsteady on their feet or who live alone and don't have someone who can stay with them when they try these products to monitor how the cannabis affects them. For anyone, again, it is very important to start low and go slow with dosing. That's the way to give you the best chance of tolerating it and getting the benefits without being put off by side effects. Cannabis hyperemesis syndrome, you see listed here, tends to occur in people who use large amounts of cannabis recreationally, where they have bouts of abdominal pain and vomiting, and it characteristically is relieved by taking hot showers. I've never seen this in any of my patients who use it for cancer symptom relief. Schizophrenia and any unstable mental illness are contraindications to using medical cannabis. As healthcare providers, our goal is to help and never to harm. Is cannabis safe for people who are receiving cancer treatment? Fortunately, experts do believe that medical cannabis is safe to combine with conventional chemotherapy. I've not seen any reports that suggest that it's not safe to combine with radiation therapy either. There's less information about newer targeted therapies, but most notable is the concern for impact on immunotherapy because of the known interaction between cannabinoids, both endocannabinoids and phytocannabinoids, and the immune system. This is a theoretical concern, not based on clinical trials, but until more is known, I advise holding off on using cannabis while on immunotherapy treatments like Keytruda, Opdivo, and Yervoy. Another safety issue worth talking about is risk of overdose. I mentioned that consuming too much cannabis can cause uncomfortable side effects, and that's important to start, and that it's important to start low and go slow with dosing. But it is reassuring to know that unlike opioids, where overdoses are a huge concern, that is not the case with cannabis. Statistics show that deaths attributed to cannabis are basically non-existent, unless you factor in accidents such as motor vehicle accidents. Whereas opioids at high enough doses can suppress breathing, causing death. There are no cannabinoid receptors in the brainstem, the area of the brain that controls breathing. This slide shows where the country is regarding use of cannabis for medical purposes and also recreationally. Remember that cannabis is still illegal federally. So people who have medical cannabis cards need to carry them at all times if they leave their home with cannabis products in their possession. And they shouldn't take products with them if they travel to another state, and certainly not out of the country. It's also important to mention that the FDA, being a federal agency, has no oversight over the quality and production process. However, Florida State does have strict oversight and designates and regulates the facilities where cannabis can be grown and processed and the dispensaries where the cannabis products are sold. Here are the diagnoses that make a person eligible for a medical cannabis card in Florida. If you have cancer, you automatically can qualify. There are certain requirements to qualify as a Florida resident in order to get a cannabis card. Since many people are seasonal residents of Florida, here's what you might want to know about qualifying for a card if you come here seasonally but reside elsewhere. And I'll give a resource at the end of the talk where you can see these and read them more closely. For individuals who may need assistance with picking up products at the dispensary, they can apply for a caregiver medical cannabis card for one designated person to be allowed to make purchases on their behalf. Notice that I say purchase. Medical cannabis, again, is not covered by insurance and it's not cheap. I always advise my patients to purchase small quantities of products until they determine what they like best and find the most helpful. I have had some patients tell me that the dispensary will take back product that patients don't find helpful and they can get a credit toward other purchases. The medical cannabis certification process begins with the person seeing a provider who has completed the training to be a qualified physician who provides education about medical cannabis, reviews the Florida Medical Cannabis Consent Form with you, and answers all your questions. That physician then enters you into the Medical Marijuana Use Registry to start the enrollment process. The registry asks for personal information such as Social Security number, Florida State driver's license number, or Florida State ID number, and a unique email address for the patient, and when applicable, the same pieces of information for the desired caregiver. They'll then receive an email with a link to complete an application online and pay the $75 fee. That goes to the state of Florida. Generally, a medical cannabis number is assigned within a few days, often the same day as the application is completed. Once this approval has been granted, the physician can place an order into the registry and the patient can make their first purchase at the dispensary of their choice. Here are more details about the ordering process. The main thing to know is that the salespeople at the dispensaries have varying degrees of expertise. Find someone who listens to you and be specific about the symptoms you're trying to relieve. They should ask you if you've had experience with cannabis before and what your reaction was. Tell them if you have any other conditions that might be impacting your recommendations, like having trouble walking steadily or needing to get up during the night frequently to go to the bathroom. In these cases, you'd want to be especially cautious about the psychoactive effects of THC. Purchase only a small quantity until you know what you like, and start low and go slow. Some of you may wonder where hemp fits into all of this. When the 2018 Farm Bill was signed into law, it removed hemp from the definition of marijuana in the Controlled Substances Act. Hemp is defined as cannabis and derivatives of cannabis with extremely low concentrations of the psychoactive component delta-9 THC, so no more than 0.3%. Prior to that, the Controlled Substance Act did not differentiate between cannabis and hemp. The passage of the Farm Bill has led to the misperception that all products made from or containing hemp, including those made with CBD, are now legal to sell in interstate commerce. The result has been that storefronts and online retailers have flooded the market with these products, many with unsubstantiated therapeutic claims. CBD has appeared in a wide variety of products, including foods, dietary supplements, veterinary products, and cosmetics. There's been less oversight of these products than was intended when the Farm Bill was passed. One concern is that a high volume of plants must be used to yield sufficient CBD to produce a product, which exposes the consumer to a higher level of pesticides and other toxins potentially than products made from cannabis plants grown by the medical cannabis industry. So I've tried to give you a comprehensive overview of why people with cancer might want to try medical cannabis to help with common distressing symptoms, what medical cannabis is, how it works, and how you can get a medical cannabis card so you can buy these products. I've listed here an excellent website that provides information about a variety of alternative and complementary therapies for cancer. And the sections on cannabis for patients and for health professionals are really interesting. You can also search for Know the Facts MMJ, which will take you to the website of the Office for Medical Marijuana Use of the Florida Department of Health for more information. I highly recommend both of these resources to help you decide if medical marijuana is for you or someone you care about. And that's my presentation.
Oh, thank you, Dr. Jacobs. That was amazing. Does anyone have questions that they want to put in the Q&A box or the chat box? I don't see anything yet. We're getting nice comments that this was awesome. But I don't see any questions. Dr. Jacob, well, you certainly answered all the questions. The generosity of the time that you spent to do all this research and put it together, we're just so grateful. I know we all learned so much from this, and I know there were many questions. And I just like everyone that's on this presentation to know that this presentation was recorded, as is all our other lectures, and it will be posted on our website in a couple of days. Lee will send you a link to that website along with an evaluation. And we really appreciate the evaluations because it helps us, it helps our speakers. And if you have any suggestions for topics you'd like to hear about, and plus it allows us to put you on our mailing list so we can send future presentations to you. And some of the comments, Dr. Jacobs, was awesome. Thank you, very helpful. Thank you so much. And there is one question. Can Dr. Jacobs prescribe medical marijuana?
So I do certifications for medical marijuana where I, go through that whole process that I explained to you for patients that are coming to the Classic program for support. So in the context of a supportive care consultation with the Classic program, patients who are interested and appropriate for medical cannabis, I will do this process.
Okay, thank you. Any other questions?
And I should just add to that answer, in case there's anybody here who, does not have a cancer diagnosis and is asking about that, the patients that come to our program are all patients with a cancer diagnosis who are getting their cancer-related care at Lynn Cancer Institute. So even someone with a cancer diagnosis who's not getting their care here, unfortunately, I can't, we would not be seeing in our program.
Okay, thank you. And Dr. Benda sent a note. It's a great presentation, and thank you so much. And
I see the comment about how expensive it is. Yeah, that I do feel good about the fact that when I do the medical cannabis certification, it's just an office visit. So if there's a copay for the office visit, then there's that. But I don't. It's true that people charge. I've seen 150. I've seen 200, and it has to be repeated, every 210 days. So that's unfortunate. Yeah, $200. Yes. I'm sorry for that.
any other comments? And as well as questions, we always, she said, but it can be tax deductible.
Didn't know.
We appreciate your comments as well. We always, along with our evaluations, we appreciate evaluations in our chat box. And that way Dr. Jacobs can see it firsthand and give her a big hug for all the work that she has put into this. And we're very, very grateful. We do hope that everyone will continue to join us on our presentations that we provide through our Zoom and Connect. And since this is Prostate Awareness Month, on September 23rd, we will have a presentation on prostate cancer and what we all need to know in 2022. And on September 28th, which is a Wednesday at 11:30 in the morning, We'll have Marie Miranda, our oncology dietitian, with a presentation on nutrition and men's health. So thank you everyone for joining us. Thank you so much, Dr. Jacobs. We
My pleasure.
truly appreciate it. And have a great weekend and afternoon, everyone.